You're tuning in because you want the crucial information distilled and delivered efficiently, especially when it comes to tackling the NCLEX-PN exam.
Exactly.
Think of this as your fast track to mastering a really foundational resource.
Yeah, absolutely. Today, we're diving deep into Chapter 1 of the Saunders Comprehensive Review for the NCLEX-PN Examination, 7th edition.
Okay.
And this chapter is really all about understanding the exam itself, which, is probably the best first strategic step you can take.
Right. It's not just any study guide, is it? This is the Saunders Comprehensive Review, 7th edition, by Linda Ann Silvestri and Angela Elizabeth Silvestri. They're highly respected nursing educators.
They are, and they've put together this resource that lines up directly with the actual NCLEX-PN test plan.
So our mission today.
Our goal really is to pull out the most vital stuff from this first chapter. We're talking the exam process, the test plan, question types, how to register, what happens on exam day.
Everything you need to know up front.
Basically, yeah. We want to give you a clear, manageable roadmap, not overwhelm you right at the start.
Okay, sounds good. Let's get right into it then. The book mentions something called the Saunders Pyramid to Success. What's that about?
Well, it's interesting because the comprehensive review, it isn't really designed to be used all on its own. It's part of a bigger strategy, this pyramid to success, like you said. It includes other resources that kind of build on each other.
Like what?
Things like Saunders strategies for test success, that one focuses more on how to take tests. Then there are the Saunders Q&A review cards for, quick practice, and an online review component, too.
So they all work together, a multifaceted approach.
Exactly. Complementary resources for your prep.
Now, the chapter really hammers home the importance of understanding the examination process itself. Why focus there first?
Well, think about how you're probably feeling right now. Maybe a bit anxious.
Probably, yeah.
Knowing what to expect logistically, how the whole process works, it can actually really help calm those nerves. Less mystery means you can focus your energy on the nursing content.
Makes sense.
In this chapter, it pulls its information straight from the NCSBN. That's the National Council of State Boards of Nursing. They're the ones who make the NCLEX.
Right, the source.
Yeah, and it's based on their 2017 test plan. They strongly suggest, and we do too, checking the NCSBN website yourself for the absolute latest info. Always good to double check.
Good advice. Go straight to the source. Okay, let's talk about a core feature. Computer adaptive testing, CAT. How does that work? It sounds kind of intimidating.
It can sound that way, but it's actually designed to be efficient. Unlike a regular test where everyone gets the same questions, CAT adjusts to you.
How so?
If you answer a question correctly, the computer thinks, okay, let's try something a bit harder. So the next question will likely be more challenging.
And if you get it wrong?
Then the next one will probably be a bit easier. The computer's trying to figure out your ability level.
So it's constantly adjusting, like it's learning about you as you go.
Pretty much. Its goal is to pinpoint your competency level as quickly and accurately as possible. It keeps giving you questions, tweaking the difficulty, until it's gathered enough information across all the test plan areas.
Until it can make a pass-fail decision.
Exactly. Until it's confident, like 95% confident whether you meet the passing standard or not.
What about the tech side? Do you need to be a computer expert?
Not at all. That's a common worry, but no. The exam starts with the tutorial. It shows you how to use the mouse, the on-screen calculator, everything.
Okay.
And there's always a test administrator there. If you have any technical problem, any question, you just raise your hand and they'll help you out.
That's definitely reassuring.
Yeah.
Okay, let's shift to the test plan itself. How is it actually created? Who decides what's on the exam?
Right. This is important because it connects the exam to real nursing. The NCSBN develops the test plan, and they have to consider the legal scope of practice for LPNs that's defined by the Nurse Practice Act in each state.
So it's tied to what LPNs are legally allowed and expected to do.
Precisely. It has to assess the knowledge and skills needed for safe, effective practice.
And how do they keep it up to date? Nursing changes, right?
It does. So they conduct what's called a practice analysis study. They do this every 3 years.
Every 3 years, okay.
Yep. They survey LPNs who've recently been licensed. They ask them, what tasks do you actually perform? How often? How important are they?
So they get data from nurses actually working in the field.
Exactly. That data forms the blueprint for the test plan. The one this book covers, implemented in April 2017, was based on the most recent study at that time. So the exam questions directly reflect what new LPNs are doing.
That makes a lot of sense. The exam mirrors the job. Okay, let's dive into the test plan specifics. What are the main components we need to grasp?
Okay, so the chapter breaks it down. Every question is designed to test three things simultaneously: the level of cognitive ability needed, the specific client need being addressed, and the integrated processes involved.
Let's start with cognitive ability. The book says it's not just about remembering facts.
No, definitely not.
Hmm.
The NCLEX-PN focuses on applying level thinking and higher. So you need to use your knowledge in patient situations.
Meaning?
Meaning you need to analyze information, make judgments, maybe even synthesize different pieces of data to figure out the best action. It's about thinking like a nurse. Table 1.1 lists the levels: applying, analyzing, synthesizing, evaluating, creating.
And there's an example in box 1.1 about IV infiltration to show the applying level.
Right. The scenario describes an IV site blanching, cool, swollen. The question asks what the nurse should do.
Okay.
So first you have to recognize those signs, that's infiltration. Then you apply your knowledge of IV complications and interventions to choose the right action.
Which is?
Discontinue the IV and apply a warm compress. You're applying what you know to solve the problem presented.
Got it. That clarifies the applying level. Now the second component, client needs. 4 big categories.
Yes. Safe and effective care environment, health promotion and maintenance, psychosocial integrity, and physiological integrity. These are like the main pillars of patient care for LPNs.
And everything on the exam relates back to one of these.
Pretty much, yes. They represent the core areas of patient needs.
And some have subcategories, right?
Yeah.
Like safe and effective care environment.
Correct. That one's split into coordinated care, think managing care, referrals, delegation, and safety and infection control, which is, preventing harm, controlling infections.
And physiological integrity, that sounds broad.
It is. It's broken down further.
Right.
Basic care and comfort, hygiene, nutrition, pharmacological therapies, meds, responses, reduction of risk potential, preventing complications, safety during procedures, and physiological adaptation, managing acute and chronic conditions.
Wow, okay. And the other 2, health promotion and psychosocial integrity.
They don't have formal subcategories listed in the same way, but they're distinct, crucial areas. Health promotion focuses on growth, development, healthy lifestyles. Psychosocial integrity deals with coping, mental health, stress management.
Does the book say how much of the exam falls into each category?
It does. It gives the approximate percentages based on the NCSBN guidelines.
Yeah.
That's super helpful for figuring out where to focus your study time.
Definitely. Now, there are examples in boxes 1.2 through 1.5. Let's look at box 1.2, the MRSA precautions question. Where does that fit?
That's squarely in safety and infection control, under safe and effective care environment.
Makes sense.
It asks about the PPE needed for wound irrigation and suctioning someone with MRSA. You have to select all the right gear. It's about protecting yourself and stopping the spread.
Okay. Box 1.3, choosing toys for a toddler.
That one's health promotion and maintenance. It tests if you know what's safe and developmentally appropriate for that age, promoting healthy development.
Then box 1 to 4, guided imagery for stress.
Psychosocial integrity. It's about understanding coping mechanisms. Does the client understand how to use guided imagery effectively? Supporting mental well-being.
Right. And box 1 to 5 has a few under physiological integrity. Digoxin toxicity, MRI prep.
Yep. Digoxin toxicity, that's pharmacological therapies, monitoring for early signs. The MRI prep question is reduction of risk, potential crucial safety steps, like removing metal. And there's one on hypermagnesemia, too, identifying signs of an electrolyte imbalance based on lab results. That's physiological adaptation. So you see how varied physiological integrity can be.
Those examples really bring the categories to life. Okay. Third component, integrated processes. What are these and how are they different from client needs?
Think of these as the how of nursing. They're fundamental skills and approaches woven throughout all the client needs categories.
Cool. What are they?
There are 5. Caring, holistic, compassionate approach. Communication and documentation, clear info exchange. Culture and spirituality, recognizing their impact. The nursing process itself. Assessment, diagnosis, planning, implementation, evaluation, the framework, and teaching and learning, patient education.
So client needs are what you address. Integrated processes are how you do it.
That's a great way to put it. They're the underlying foundation.
Box 1 to 6 has an example for caring using therapeutic communication.
Right. The scenario is a client who's scared about a procedure. The question focuses on using communication not just to give info, but to explore feelings, show empathy.
Not just brushing off their fears.
Exactly. It shows that caring is an active part of the process. Effective nursing isn't just technical.
Got it. That distinction is helpful. Okay, let's switch gears to the types of questions. It sounds like it's not just your standard multiple choice anymore.
Oh, far from it. While you'll definitely see standard multiple choice, you need to be ready for others. Fill in the blank, multiple response, where you pick all correct answers, ordered response, which is drag and drop prioritizing.
Okay, wait. Multiple response and ordered response. Let's break those down.
Sure. Multiple response means there could be several right answers in the list, and you have to check every single one that applies. No partial credit if you miss one.
Ouch. Okay.
Box 1-8 has an example about epiglottitis interventions where several actions are needed.
And ordered response, the drag and drop.
That's all about prioritization. They give you a scenario and a list of actions. You have to drag them into the correct sequence, the order you'd perform them. Figure 1-1 shows tracheostomy care as an example.
Prioritization is huge in nursing, so that makes sense. What else?
Figure questions based on an image like a heart rhythm strip in box 1-9. Chart or exhibit questions where you click tabs to find info, like in box 110 about contraceptives.
So reading charts and interpreting images.
Yep. Then graphic option questions, the answers are pictures, like box 111 showing enema positions. You click the right picture.
Okay, visual answers.
And even audio and video questions.
Audio and video, really?
Yeah. Audio might have you listen to lung sounds or heart sounds with a headset. Video might show a short clip of a procedure or interaction. Figures 1-2 and 1-3 hint at these. The Evolve site likely has practice ones.
Wow, that's quite a variety. And the key thing is they're all scored right or wrong. No partial credit on any of them.
That's what the chapter says. All or nothing for each question. It's important to remember that.
Definitely. Okay, what about fill in the blank again? Mostly for calculations.
Primarily, yes. Dosage calculations, IV flow rates, intake output. You type in a number.
Any tricks there?
Pay very close attention to rounding instructions.
Yeah.
They'll tell you how to round, if needed. And remember the decimal point if your answer needs one. Box 1-7 has that acetaminophen calculation example.
Okay, good tips. So knowing these formats is key to not being thrown off during the exam.
Absolutely. Familiarity reduces anxiety.
Let's move to the practical side. Registering to take the examination. What's step one?
The absolute first thing, according to the chapter, is get the official NCLEX Examination Candidate Bulletin. Download it from the NCSBN website.
That's the rule book.
Pretty much, it has everything. Then your first action is applying for licensure with your specific state board of nursing.
It's state where you want to be licensed.
Exactly. And remember, the process, the forms, the fees, they can vary quite a bit from state to state, so you have to check with your specific board.
And be careful with the paperwork.
Oh, yes. Follow instructions precisely. Fill everything out accurately. Pay the fees. Any mistakes can cause major delays. You'll likely have a fee for the NCSBN and separate fees for your state board.
Okay. Once you apply and you're eligible, you get the authorization to test, the ATT.
Correct. And that ATT is critical. You cannot, absolutely cannot schedule your exam appointment without it.
What's important on the ATT?
Note the validity dates. There's a window when you have to schedule and take the exam. Don't let it expire.
Good point.
It will also have your authorization number, candidate ID stuff you need for scheduling, and for test day. And you don't necessarily have to test in the state you're getting licensed in.
Oh, interesting. You have to bring the ATT to the test center, right?
Yes, definitely. Bring a printed copy. They will likely check it against your ID.
What if something comes up? Can you change your appointment?
Usually, yes. You can typically reschedule through the Pearson BUE website or their candidate services. The candidate bulletin has the details.
If there are deadlines.
Absolutely. Crucial deadlines. If you miss your appointment or cancel too late, often less than 24 hours, but check the rule, you forfeit your exam fee.
Wow.
And your ATT becomes invalid. You'd have to start the registration process all over again, fees and all. So plan carefully.
Definitely. Okay, day of the examination, what's the advice there?
Arrive early, at least 30 minutes before your scheduled time. This gives you buffer for check-in, finding the place, calming nerves.
What if you're late?
Big risk of being turned away. And again, forfeiting your fee.
So do a dry run.
Highly recommended. Drive there beforehand. Know the route, parking, how long it takes. Avoid that stress on the actual day.
Smart. What about ID? What do you need?
Your printed ATT and valid unexpired government-issued photo ID, driver's license, passport, state ID, military ID usually work.
Key things about the ID.
Must have your photo, must have your signature in English, and the name must exactly match the name on your ATT.
What if the name doesn't match exactly? Like after marriage?
You'll need legal proof of the name change, marriage certificate, court order, No exceptions. Get that sorted out beforehand.
Good to know. What about testing accommodations for disabilities?
You need to arrange those way in advance. Contact your state board of nursing before you even register.
Not Pearson v. UE.
No, start with your state board. They have the process and documentation requirements. Both the board and NCSBN have to approve the request.
So plan way ahead if you need accommodations.
Definitely. You can't just ask for them on test day at the center.
Okay, let's picture the testing center. What's the environment like? Security.
Expect it to be very secure and standardized. Strict ID check. You'll read the rules. They use biometrics now, fingerprint or palm vein scan, digital photo, signature.
Wow. Okay.
If you leave the room for a break, you go through the security check-in again when you come back.
What about personal items?
Yeah.
Phones, bags?
Absolutely no electronics in the testing room, no phones, no smartwatches, nothing. You'll get a lockable bag for your stuff stored in a locker outside.
And space is limited.
Usually, yeah. Don't bring tons of stuff. And the center isn't responsible if anything happens to your belongings. Also, friends or family can't wait inside the building.
What's the actual workspace like?
An individual computer station. They provide an erasable noteboard or laminated sheets and a marker for calculations or notes.
Could you bring your own scratch paper?
No. Only what they provide. No food, no drinks, no tobacco in the testing room either.
And they watch you.
Constantly, either a person or via camera and audio recording. If you need anything, computer help, clean board, marker, a break, you raise your hand.
Can you get earplugs?
Yes, they usually have them available if noise is an issue. The NCSBN website actually has a virtual tour of a test center, which can help you visualize it.
Good tip. Testing time. How long do you actually get?
Maximum of 5 hours total.
Total for everything.
Yep. That includes the intro tutorial, any sample questions, any breaks you take, and the exam itself.
Breaks count against the time.
Yes. All breaks are optional, but the clock keeps ticking. And remember the re-entry security check if you leave the room. Time management is critical.
Okay, 5 hours max. What about the length of the examination in questions? Min and max.
Minimum number is 85 questions. Maximum is 205.
But wait, some are unscored.
Right. Of those first 85, 25 are pre-test questions. They're trying them out for future exams.
Can you tell which ones they are?
Nope. They look just like the real ones, mixed right in.
So you answer between 85 and 205 questions, depending on how you do.
Exactly. The computer stops when it's 95% confident about your ability relative to the passing standard, or when you hit the 5-hour limit, or the max number of questions.
Which brings us to pass or fail decisions. How does the seed decide?
It's all about that 95% confidence level. Scenario 1, clear pass. The computer is sure your ability is consistently above the passing standard.
Okay.
Scenario 2, clear fail. The computer is sure your ability is consistently below the passing standard.
And the third one, the run out of time rule.
Root. Right. This happens if you hit the 5-hour mark before the computer reaches that 95% confidence.
Then what?
If you answered fewer than 85 questions total, you automatically fail.
Ouch. Okay.
If you answered at least 85, the computer looks at your performance on the last 60 scored questions you answered.
The last 60.
Yes. If your ability estimate stayed above the passing standard for all of those last 60 scored questions, you pass.
And if it dropped below at any point during those last 60?
Then you fail. It's complex. The chapter says check the candidate bulletin for the full official details on the root rule.
Definitely need to understand that.
Yeah.
So manage time and stay consistent. What happens right after the test ends? Completing the examination.
There's a short optional survey about your experience. After that, or if you skip it, you raise your hand. The administrator collects your noteboard and marker, and then you can leave.
And then the waiting game for processing results. No instant results at the center.
No, definitely not. They double score everything once at the center, again, centrally. Accuracy is key.
How long does it take?
Official results come from your state board of nursing, usually mailed about a month later.
A month. That's a long wait.
It can feel like it. But many states offer an unofficial quick result service through NCSBN.
How does that work?
For a fee, you can check online, usually about 2 business days after your exam. You have to check the NCSBN site to see if your state participates. It's unofficial, but usually accurate.
Okay. What if someone doesn't pass? They get a candidate performance report.
Yes. And this report is actually very useful if you need to retake.
How so?
It breaks down your performance by the main client needs categories. It tells you where you were strong and where you were weak above, near, or below the passing standard in each area.
So it guides your studying for the next time.
Exactly. It helps you focus your efforts. And remember, there's a waiting period before you can retake, usually 45 to 90 days, depending on the state, and you have to re-register and pay again.
Right. Now, because NCLEX is national, there's interstate endorsement. What does that mean?
Basically, if you pass the NCLEX and get licensed in one state, you can usually apply for a license in another state without retaking the exam. That's endorsement.
But it's not automatic.
No. Each state has its own requirements and process for endorsement. You have to contact the Board of Nursing in the new state you want to practice in to find out their specific rules.
Okay. Lastly, the chapter mentions foreign educated nurses. Any key points there?
Box 112 lists some common requirements, things like proof of citizenship or visa, official transcripts, maybe a credentials evaluation to compare their education to U.S. standards.
And requirements vary by state here, too.
Absolutely. Good point. Maybe it's the CIT format, maybe it's the registration details. Pinpoint what needs your attention.
Well, remember, this journey to becoming an LPN is a big deal. Taking the time now to understand the exam itself really builds that strong foundation for success.
Absolutely. With solid prep and knowing what's coming, you're definitely setting yourself up well.
And that wraps up our deep dive into Chapter 1 of the Saunders Comprehensive Review.